Okay. Good evening. Welcome to our live today. It's 4th of April 2024 at exactly 6 minutes past 7 p.m. all 19 hours East African time. Thanks so much for joining our live today, those of you on YouTube and also those that have joined us via TikTok. Thank you so much for being a part of our audience today. I want to inform you that tomorrow we are premiering a video about the tips. You know, if you want to have the tips of if you want to conceive fast, you've been struggling to conceive, you have issues here and there, you want to know what to do in order for you to conceive, we are premiering that video live tomorrow, and therefore be available at exactly 8 p.m. all 20 hours East African time. We shall be showing that video or at only Ask Dr. UTHUMAN YouTube channel. So be there or be nowhere. And like as usual, we are going to be answering your questions today. And just put your question, and I appreciate questions that are medical and concerning fertility or reproductive health. There are some of you that ask me questions regarding malaria, regarding typhoid and so on. Please ask questions regarding fertility management. All right, straight away, I think we are going to begin with question number 1. And like I've always told you, we answer questions depending on how they have come in, how they have trickled in. We don't have any preference that we answer such and such people. We answer everyone that asks, and depending on when first come, first serve. Therefore, we shall begin with question number 1 is from Chichi, saying, why do I feel pregnant all the time? I don't know, but in most cases, people feel pregnant all the time because of anxiety. And actually, let me tell you, those people that feel pregnant are actually not pregnant. You find, and those are the people that really want to get pregnant. You find someone is frustrated, someone has been, maybe it's been 5 years, 6 years, 10 years, they're looking for a child, and all of a sudden, they start getting signs and symptoms of pregnancy when they are not pregnant, and that is anxiety. It's because of the anxiety disorder you're having, because you really want to achieve pregnancy so much, and therefore, there is a way the body reacts, and you get the signs of pregnancy when you're not pregnant. We have another one, is called Kwagala Madina. Good evening, doctor. Good evening to you, Kwagala. Then Nasuna Swabra is saying, hi, doc, what causes period flow to reduce from 5 to 3 days? That is a reduction in the number of days, okay? Number of days someone undergoes periods is as a result of hormonal fluctuations. That happens when there is hormonal fluctuations, okay? When there is hormonal interplay. When there is hormonal interplay, because usually what drives periods, it's the hormones. So if there has been an imbalance somewhere, or maybe progesterone has gone low, or prolactin has gone high, and so on, we can have that reduction in the number of days. It can also be as a result of use of family planning. There are some family planning methods that can cause that. Especially for an IUD, most people will have increase in the number of days, but you'll also find that some methods will reduce, others will increase. So it can be as a result of a family planning method you're using, or as a result of hormonal fluctuation, or stress and anxiety disorders. Then we have Chichi again is saying, I have one ovary. I have tried to conceive for 2 years now. No result. Let me tell you, one ovary, if you have one ovary, you can still conceive, because a woman needs only one egg for them to conceive, okay? So one ovary, you can still conceive. Now, the reason as to why you're not conceiving may not be because you have one ovary. As long as you have one ovary, it has ovules or it has eggs, and they are normal. They are normal. They have no abnormality. They are not diseased. Then you'll be able to conceive, except if there is any other problem. Therefore, I would request you to also do other investigations to confirm that that is the only problem you're having. You may be having tubes that are blocked, or even that ovary that is left there because you have one ovary. You may find that that ovary doesn't have eggs, doesn't have ovules, or if the ovules may be there but diseased, so the quality and so on. So you have to look at all that So the issue may not be on just one ovary, may be something more than that. Franklin Obes is saying, hi doctor, please, how can I conceive twin girls? Conceiving twins, I've already discussed it here. And check, please, it's called Franklin Obes. Check in one of my videos, I think, check on our channel, check one of my videos concerning how you can conceive twins. I gave very, very clear explanations on how you can conceive twins, and that's something very easy we talked about here. Check out that video, How to Conceive Twins by Dr. UTHUMAN. Check it on our channel, you'll see it. And secondly, even whether twin girls, boys, and so on, I still released a video concerning how to conceive a baby boy, how to conceive a baby girl. You check still on my YouTube channel. Those videos are there, and they have a very clear explanation, which I may not be able to even give you because of the limited time we are having on the live today. But check that video. Check a video concerning how to give birth to twins. It's there. Give birth to twins, triplets, quadruplets. It's there. Also, a video concerning how you can give birth to a baby boy, a baby girl. The tricks you can use. So now when you combine the two tricks of twins and conceiving baby girl, then I think you can now be able to conceive twin girls. Then we have Athea George, try not getting, I don't know what you're asking. Kadina Christo is saying, hi doctor, how can I convince? Convince what? You convince who? I don't get you clearly. Rukaya Bodinga is saying, what is the cause of POS in young adult? POS, what's POS? Maybe you've spelled it wrongly. You should tell us what you meant by POS. Rukaya Bodinga is saying, is there any possible treatment or solution to this problem? Which problem? Because POS, we've not understood POS. There are many conditions. I don't know whether you're meaning polycystic ovarian syndrome or you're meaning some other disease. I don't know, but please be specific on what you are asking. Then Nama Gembe Ruth is saying, I flow for 5 days, doc. Okay. Can you use this? Susan is saying, good evening, doctor. I have too much pain during fertile days. It's like I want to go back in my mens, and I have very little blood flow during my menses. What could be the problem? There is no problem. Having pain during your fertile days is a good sign. Actually, that's a sign. That day you have pain is the day your ovulation will have started. So those are ovulation pains, and there is no problem about that. And it's as a result of the surge in the levels of luteinizing hormone. So there is no problem about that. Fatigue is saying, please sir, can hydrotubation unblock the fallopian tubes? Yes, hydrotubation is one of the methods that can be used to unblock fallopian tubes, though it is not the best method. Another one is saying, Quinatix Inxumisang is saying, hello doctor, I have 2 boys. I've been trying for a third and is not coming. It's been 2 years now. 2 years you're not conceiving. Check out our video. There is a video we are releasing. Quintax that name. Tomorrow at exactly 8 p.m. or 20 hours, 20:00 hours East African time, or 8:00 East African time. We are going to be releasing a video on this channel. Check it out. It's concerning the tips how you can get pregnant fast. What the workout for you to get pregnant. We release that video. Please, it's going to be premiering tomorrow at exactly 8 p.m. Check it out. It will give you the answer. Okay, Comfort Simon is saying, please doctor, when is the good month or week to know my baby's gender in utero? All right, at 26 weeks, that is the best time you can check. You can do an ultrasound scan and it will be able to show you the gender of your baby. 26 weeks. Yes, 26 weeks. Then Rehma Kerubo is saying, Bopo, hey doc, I did FHG and cold agglutinins were seen in my. Is it something I should worry about? Also, my HCT was a bit low and lymphocyte. Please, these are questions really, I think you're asking about full hemogram. I have already said here that please ask me questions regarding your reproductive health. This is not something regarding reproductive health because I'm saying that you did tests concerning anti-inflammation, okay, inflammation and so on. So these are things regarding bloodstream infections and so on. So please, I would request you to ask such a question to a physician, okay, a physician or an internal medicine specialist. So here I really welcome questions regarding reproductive health, questions regarding fertility. So those are the questions I am really comfortable with. Okay, Athea, I have tried to get pregnant, it now work. Okay, Franklin Obes, thanks doctor, please, is there any medication to improve twin conception? Yes, the medicines are there. I have already said it that there are medicines that can help you increase your chances of conceiving with twins. And check that video, it's there. And those medicines are the gonadotropins of this world. I released the video, check on one of my videos on YouTube concerning how to give birth to twins. But of course, those gonadotropins, the likes of letrozole, the likes of clomiphene, the likes of tamoxifen, those medicines can be used. But how to use them, etc., check that video. But it is possible for someone to conceive twins when they want and by using medicines. Then we have confidence ahibogu, taking folic acid with vitamin D. Is it good for trying to conceive? For a trying to conceive mother, there is no problem with taking folic acid, and there is still no problem with taking vitamin D. Sorry, there is no problem with taking vitamin D, and there is no problem with taking folic acid when you are trying to conceive. So it's okay to take them, though they are not going to, if at all, because the problem here is that people will want to use these medicines. Like someone has failed to conceive, maybe it's been 3 years, 4 years you're not conceiving, you've not yet even investigated the cause of your failure to conceive, and then you end up, someone tells you you can take vitamins, take vitamin D, take folic acid to be able to conceive. That's where I decline to say yes. So it's okay to take these medicines, but when I tell you to take them, you take them as a substitute for treating infertility. These medicines do not treat infertility. Infertility is treated by tackling the cause. For example, you may be having tubes that are blocked. Even if you take, I don't know, 1,000 tins of folic acid and a trillion tins of vitamin D, you will still not conceive because the tubes are blocked. So do not take them in the place of other causes of infertility. Then Sarah Abel is saying, hi doctor, I just did my tubes flashing. I was told that I am lucky I may get pregnant at the first flash. All right, all the best. We wish you all the best. Okay. Okay. Wait, let's get more questions here. Someone is saying, okay. Please, sir, can I don't? Okay, I answered you. Doctor, what can we take to increase estrogen? All right, if you want to increase the levels of estrogen, take estrogen supplements, take estrogen medicines, okay? There are medicines that contain estrogen. There are some tablets in form of tablets you can swallow. There are injections, estrogen injections. There are many medicines that you can take. So if you have low levels of estrogen, you can take estrogen supplements. Even pessaries for estrogen are there. How to conceive this May Fairy, how I can conceive a girl. I've already said that there is a video on my YouTube concerning how you can conceive a baby girl. But usually I've said that for a baby girl, have sex 5 days prior to your ovulation day. Yeah. Okay. Someone is saying, Sweet Rose, doctor, how much is IVF? IVF cost depends on from hospital to hospital. I may not tell you that this is the cost, but each hospital charges differently, and it also depends on the country where you are. So each country has different rates, and each hospital also has different rates. Okay. Another one is saying is called Jennifer Gigi. Hi doctor, it's now 4 days. I'm seeing milk white mucus. I'm seeing milk white mucus, abdominal pain, and nipple pain. Is it because I'm in the week to see my another period? Those signs you're talking about are likely to be ovulation signs. Those are signs of ovulation. Yes, those are signs of ovulation, and you may be having ovulation. The ovulation may be taking place. So watch out. If you want to conceive, probably that could be the best time. And if you don't want to conceive, then you have to avoid that time. So that is likely to be an ovulation period. So that is likely to be ovulation period, and that is the period that has very high chances for you to conceive. Then we have another person here, a comparison. Susan is saying, I have been following you, though I don't normally comment, but I'm already pregnant after following the instructions. All right, let's congratulate a comparison, Susan. She followed the instructions and she's pregnant. Congrats to you. All right, Tessie Terry, how are you and where are you calling from? Yes, Tessie Terry, how are you and where are you calling from? Be very loud with your question.
I'm good, I'm from Kenya.
You're called who?
Terry.
Yes, what's your problem? Where are you calling from? Be very loud, you're low, you're too low.
No. I'm from Kenya.
You're from Kenya, yes?
Yes.
Go on with your question. Please, I'm going to take you off because you're very low. You are very low. Your volume is very low and I'm not able to hear you clearly. All right, we shall lose you. We shall lose you because you're too low. Okay, then Nasuna Sabra, what are signs of high prolactin? Signs of high prolactin. If you have high levels of prolactin, you'll be having discharges from the breast. You see, when a woman is not breastfeeding and all is not pregnant, if you are not breastfeeding and you are not pregnant, we are not supposed to see any breast milk from your nipple. But when you start seeing breast milk from your nipple when you're not pregnant, that is a sign that you have high levels of prolactin. When you see breast milk in your nipple, when you press the nipple, your breast, and there is some milk that is coming out, yet you are not pregnant or you are not breastfeeding, that is a sign that the levels of prolactin are high. Okay, Mensa Isaac, hello doctor, my wife is pregnant for 2 months but confirmed of having PID during her scan. Can it affect the baby? Yes, a PID can affect the baby, therefore I would advise you to treat it. Treat a PID immediately. The moment you're pregnant and you get a PID, treat it immediately. We have Doreen Tindimwewa, hello doctor, what can an expecting mother feed on to prevent gestational diabetes? Number one is that do your antenatal very well, and during the antenatal, make sure that you're checking your sugar levels. Number two, avoid high calories food and also do exercise when you are pregnant. It will help you. Tindimwewa, are you pregnant? Did you conceive? If so, then you can let us know and we congratulate you. Then we have Berian Mwape. Good evening, doctor. What are the treatment of low female hormones, estrogen and progesterone? If you have low levels of estrogen, then you take estrogen medicines. The medicines are there that increase levels of progesterone, and also medicines for progesterone are there. And for progesterone, there are many. They include the likes of progesterone-only pills, and also even this injection, you see the hydroprogesterone, medroxyhydroprogesterone is also contains progesterone analog. She's Fit is saying, hi doc, when is the right time during the cycle to do an AMH FSH? Any time is okay for you to do fertility hormones, as long as you see, I've always seen people, when you tell them to do fertility hormones, they ask you, when should I do it? Is it when I'm starting periods? Is it? Do your fertility, check your fertility hormones anytime you want. As long as you note that time, we shall be able to correlate the levels with the reference ranges. Because each time, anytime you do, because if, for example, if you do this test during the luteal phase, we shall correlate results with the luteal phase reference ranges. So do the test at any time of your choice. Then we have another person is called Agalejo Walter. Good evening, doctor. When can I know my woman is ovulation day? Your woman is ovulation day. The day when she feels, actually, let me tell you this. When a woman is in her ovulation, that is the day they feel they want to have sex so much. When you see that your woman wants to have sex, she has a high libido. It's like, I think you've seen cows and goats. When they are on heat, you really know that they're on heat. A cow will cry from morning to evening, will mow from morning to evening when it is on heat. Will feel like they want to mount every cow they see around. They will develop discharges at the vulva, okay? So they'll have discharges, they'll want to mount or to climb every animal they are seeing. They excessively make noise. They are loitering around. They don't want to eat. So the same applies to a woman. When a woman is on heat, when a woman is during her ovulation, that is the time they can hardly say no to sex, okay? They really want to have sex. That is the day. 2, they also have heat. They also feel warm, okay? They feel warm. That is the day they feel warm. They feel warm. 2, they are also high, okay? They are also up and down. So all those signs can indicate that someone is on heat all in their ovulation. Rakaya Bodinga, you kept skipping my question. Which question, Rakaya? Please ask it again. I will answer it. You know, sometimes it's not that I skip the question. It's because sometimes questions are many, and maybe I scroll without reading the question. So please ask the question again. Can an ultrasound scan pinpoint the exact date of ovulation? The ultrasound scan cannot show you the ovulation day. No. The ultrasound scan cannot show you the ovulation day. Yeah, it can't. But there is an ovulation tracker, okay? And there is also a test which you can do, which is LH test. Yeah, you can do it and confirm whether you are ovulating. Her father's daughter is saying, I need to get pregnant. All right, who is stopping you? All the best. Please get pregnant. No one is stopping you. Okay. Okay. Dawa ya infection, please. Please, on my channel, we use English, please. I only use English on all my channels, so we don't communicate using any other language on this channel. Does piroxicam tablet bad for periods? No. There is no problem with piroxicam tablets and periods. They are friends. They have no problem. Yeah. Okay. 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 We have many questions here. Doctor, answer me, please. Do you do IVFs? There are several facilities that can do IVFs, and I don't know where are you. Let me know the country where you are from, because at times when you say, because it's you, the same person who was asking about the price. It depends on the country where you are, but IVFs can be done. In Uganda, yes, IVFs can be done, and in Uganda, IVFs range from 25 to 30 millions, depending on the conditions, because every individual is different. Tests can be done to identify which difficulties you're having, and then an amount can be established. Chichi, I keep having chemical pregnancies. Sorry about that. I think I'll discuss chemical pregnancies in one of my next videos. I will, and I promise. Mensa Isaac is saying, which medicine is effective for treatment of PID during pregnancy? Cephalosporins can be better. Cephalosporins are the best in treating PID, but in this case, don't use doxycycline. Don't use doxycycline in this case when you're treating PIDs in pregnancy. Okay. Then we have another question here. Rukaya Bodinga is saying, I want to discuss premature ovarian failure treatment and prognosis. Oh, you want me to discuss about premature ovarian failure? Premature ovarian failure is a very big topic, which I need to discuss, I think, in one of my next videos. But just know that most people, some of the causes of premature ovarian failure is as a result of chemotherapy. People taking chemotherapy, toxins, different toxins or poisons can cause premature ovarian failure. And so, in other words, radiations, those people who are on anti-cancer medicines, and also the radiations as a result of cancer, because some people, there's a stage of cancer that is treated by radiations. So those radiations can cause premature ovarian failures. There are very many causes of premature ovarian failure, but I think I'll get time and really discuss on how to on the causes and treatment. But of course, in most cases, most of those premature ovarian failure, we treat using hormonal replacement therapy. So we give you hormones. Okay, we give you hormones, because just know that why there is premature ovarian failure, there is now a deficiency. There is some hormone that is imbalancing, and therefore in such people we do fertility hormonal assay to identify which hormones have been affected in the process, and then we can give you hormonal therapy or hormonal supplement for that. I think I will have a time and discuss it. Okay. We have Rashid Kukum Kasumba is saying, Doctor, why is my wife seeing blood 2 days after sexual intercourse? Is she pregnant? 2 days after sexual intercourse, seeing blood, she's likely to be sick. Okay, she's likely to be sick, and she'll need, because we can be having issues of cervicitis, we can be having issues of actually the whole of the PID issues and so on. So, or maybe she has a hormonal variation, hormonal fluctuations somewhere, hormonal imbalance and so on, but likely to be all an infection somewhere. So you're advised to do tests to confirm what the problem is. Okay. Chichi, does overcare have ugly side effects? Maybe nausea and vomiting, not any other serious ugly side effects. Berian Mwape, Doctor, can fatty pill plus capsule maintain normal level of hormones? You see, before you take this pill, first confirm which hormone has a problem, okay? Before you take those pills, first confirm which hormone has a problem and take the appropriate medicine. Nakanja Kosafin, hi doctor. I have been using Chinese pill for 4 years. Sorry. And I think I have seen many people using Chinese pills, but most ministries of health in all countries have warned people against using Chinese pills, but people keep on taking them. Please, those Chinese pills have caused a lot of problems to people. They have caused a lot of infertilities, hormonal imbalance, etc. to people, but still people use them. I don't know why. Okay, let's hear the question. Hi doc, I have been using a Chinese pill for 3 years, but I have decided to leave it so that I can get pregnant. But I have spent 3 months without my periods. But on 27th March, I do see periods. It's going to take me. It's going to take me. What do you mean? I'm not getting the question. I don't know if you people have really understood the question. I've also not picked exactly what she's saying. Please ask the question clearly. You've started the periods and they are going to take you. What do you mean? She's fit, doctor. My man did semen analysis. My man did semen analysis. Everything is fine. I also did vaginal ultrasound scan. Everything is fine, but still not conceiving, and did take prevention pills. Now you see, if your man did a semen analysis and everything is okay, that is okay with your man. Now for you, if you only did an ultrasound scan, that cannot really give you a basis to. I have already said that if you want to get pregnant, if you're failing to get pregnant, do all the tests to confirm what is stopping you. It is not only the ultrasound scan that will show you where the deficiency is. There are several tests that can be done, and I invite you tomorrow at exactly 8 p.m. all 20 hours East African time. We are going to be releasing a video on the workout. What are you supposed to do if you delay getting pregnant? If you fail to get pregnant, what are you supposed to do? The workout you're supposed to do in order for you to conceive. We are going to be releasing that video tomorrow at exactly 8 p.m. on our YouTube channel. Please check it out. It's going to be released. You'll be able to learn about many things. Okay. Akampereza Susan, I'm 2 months pregnant, and I have ever since I am 2 months pregnant, and ever since I got pregnant, I have been having low abdominal pain. But I tested for UTI and it's negative. What could be the problem? There are very many causes of low abdominal pain, including PID, pelvic inflammatory disease. So, apart from testing for UTI, also go and do an ultrasound scan to confirm that your tubes are normal. Toto, hello, how are you? Where are you calling from? And what is your problem? Okay. Okay, I think we are continuing with our questions. This one is saying, Jonah Abigail, good evening, doc. Please, can PID stop a woman from getting pregnant? If yes, which medicine is good for treatment? Yes, PIDs can stop someone from conceiving. Yes, it is possible, very, very possible. Check one of my videos on YouTube talking about how to get pregnant with PID. It is there, and PIDs can stop you from getting pregnant. Best medicines, there are antibiotics that can be, of course, you first find out the cause. Some PIDs are infective in nature, that means you can use antibiotics, but others are inflammatory in nature, therefore you use anti-inflammatory drugs. And I think we are going to say bye-bye to those of you on TikTok Live. We are continuing our live on YouTube. Please, those of you who are on TikTok and are still interested in asking questions and getting answers from me, go to our YouTube. It is Ask Dr. UTHUMAN. The live continues, but we are saying bye-bye and salute to those of you on TikTok. So we are continuing. Sharif. We are continuing our live on YouTube. So we continue with these questions. This one is saying, Sheten Shering is saying, Doctor, my sperm concentration is only 6 million. How can I improve? Improving sperm count, if you want to improve sperm count, there are medicines that can be used. I've already discussed some medicines which we can use to improve sperm count, and those medicines include the likes of Manix and Zimans of this world. There is also Pecos. Those medicines can be used to increase sperm count. Behan Yima is saying, hi doctor, I have been using Photomid 7.5 per day before 3 months. Before 3 months. I end up becoming positive. Then after 6 weeks, no heartbeat. Then went to miscarriage. Now I'm using again. For how long should I try? You try as much as possible. You can try using those medicines as much as possible. But I hope that is you're using them for the right cause. In other words, the problem is with LH-FSH. So you can try them as much as possible. There is no limitation to that. Okay. We have another person, is called Nakanjako Safina. My question was, it's going to take me how long to conceive? To take you how long to conceive after what? After what? Let me check. I think, okay, it's you who was using a Chinese pill. Now, about the Chinese pills, I don't know how long it takes for you to conceive again after using a Chinese pill, because the Chinese are not disclosing the chemical component in this pill. And that's why we are stopping, or we are advising people not to use this medicine, because its mode of action, how it works, is not very clear. And even when someone develops side effects of the pill, it becomes hard for us to treat you because the chemical components are not very clear. Its mode of action is not very clear. So that's why we advise people, when you want to use family planning, go for these methods of family planning that are known. Do not please use Chinese pill. And it has been found to cause very many side effects in the body. Yeah. Okay. Okay. This is Praxides Mukoto is saying, following Kiria from Kenya. All right, say hi to those people in Kenya. All right, I think, by the way, for those of you who have issues with the IT, you want to understand issues concerning your computer's problems, you want to understand issues concerning social media channels, issues concerning cameras, security cameras, and so on, you want to run your social media channels, please visit a YouTube channel called it.next. it.next, please display it. It's being run by our man behind this camera. Caseberg is an expert, IT expert. Go there and ask questions regarding your information technology. So we have another question. Number one, Kawini saying, good evening, doctor. What causes paralysis of one leg during my period? Of course, I've already discussed about hormonal fluctuations and how those hormones interfere with the normal functioning of the body, and that's what happens. Then Elizabeth Akoma, good evening, doctor. Please check this medicine for me. Pregnacare conception, because I want to conceive. Pregnacare does not make someone conceive. If you're failing to conceive, find out what is stopping you from conceiving and address the challenge. Pregnacare contains some medicines, find out whether it is that hormone, it is that chemical that you're lacking in the body, and that's why you should be able to take it. So please, if you're failing to conceive, run tests. And by the way, this one is called Elizabeth Akoma. Tomorrow at exactly 8 p.m., I'm premiering a video on the workout when you fail to conceive, what can you do? We are premiering that video tomorrow at exactly 8 p.m. or 20 hours East African Standard Time. East African Time, 20 hours or 8 p.m. East African Time. We are going to be premiering that video. Be there or be nowhere so that you can learn about what you're asking. Doctor, please, sperm count 6 million is low to conceive. Yes. Sperm count of 6 millions is low. It is low. It is low, and therefore you should use medicines in order for you to have to make someone pregnant. If it's your very first time to watch my channel, please do not forget to subscribe and also press the notification bell in order to be notified of any important video we release. And also, those of you who would like to have a private chat with me privately, go to my website and book an appointment. It is www.druthman.com. Book an appointment. I'll be there to chat with you. It has been that for today. Thanks so much for watching my channel. I sign out. Have a blessed evening.
When you are sick, you need a good ambience to pick your medicines. Maogola Pharmacy is here for you. Has human medicines for both retail and wholesale. Found in Sembabule and Chigangazi Town Council. Call us on 0200 908 184 Sembabule or 0700 577 241 Chigangazi. At Maogola Pharmacy, we serve with care. When
Welcome to Bikoff Medical Center, located in Masakasi and Sembabuli Town Council. We have a dedicated team of health professionals ready to serve with love and care. We offer a wide range of services, a diagnostic laboratory, ultrasound scan, dental services, maternity and surgical services, physiotherapy, For more information, call us on 0759 54 1708 Masaka and 0759 54 1703 Sembabuli. Bikoff Medical Center, we treat good health.